I would say rather head and neck cancers. Head and neck cancers, the main imaging modalities predominantly are CT scan. It is a contrast enhanced CT scan, which means we inject a dye. I am Dr. Snehal Shah. I am a robotic throat cancer surgeon. Now, contrast enhanced CT scan is done from skull base to root neck or sometimes to thorax. We also cover thorax, which means a chest. CT chest is also included in the imaging modality, especially for advanced cases. For early cancer cases, we will restrict ourselves till the root of neck, that is skull base, that is from head and neck. We don't extend the images below to the chest. Now, the CT scan machines which are available are 32 cuts, or for that matter 64 cuts. So those which are preferred are with 32 or 64 configuration, which are predominantly chosen for a better imaging modality, for better differentiation or for better understanding of the disease extent. Apart from that, CT scan, we also have MRI. They will also predict for bone involvement, especially a bone marrow involvement, and MRI has to be again with the contrast, again from skull base to root neck. And if we do MRI mainly for tongue or for other soft tissue, that is for floor of mouth or for base of tongue or for hypopharynx, then it has to also, then it will go from the skull base to root neck, and it has to be with the contrast. Apart from CT scan, MRI, there are other modalities such as DENTA scan or orthopentomogram, which will also help in detecting the bone involvement, bone status. The earliest possible bone involvement with the sensitivity specificity which is almost equal or almost reasonable is with the CT scan followed by MRI, but studies also quote that MRI is equally effective enough or sensitive enough or specific to be more precise in picking up the bone involvement, bony involvement, that is involvement of the mandible, which is the jaw, a lower jaw, and an upper jaw, which is maxilla. So apart from CT scan and MRI, we also have ultrasound. I am Dr. Snehal Shah. I am a robotic throat cancer surgeon based in Mumbai. Ultrasound is used predominantly for superficial lesions. It is also used for parotid malignancies, for thyroid malignancies. It is also used to characterize a neck node in the secondary to the oral cavity or malignancy, or for that matter even the hypopharyngeal or laryngeal, that is a food pipe malignancy or even a air pipe malignancy that a patient can have. So ultrasound is another modality. The fourth modality that is used is a PET CT scan. PET, contrast enhanced CT scan. 18 FDG PET CT scan is basically used. It's a whole body scan. It is used for advanced cases, oral cavity cases. It is used for N3B neck node metastasis. Neck node metastasis, which is N3B, is a size of neck node which is more than 6 centimeters. For that, or multiple neck node involvement or low lying neck node involvement, these are the cases. Or for residual or for recurrent tumors, we use PET CT. PET CT is also used for RT planning, radiotherapy planning. So PET CT is another modality which is nowadays used. People also recommend PET CT upfront for an advanced disease. They say that the utility is much more than CT scan because the pickup rate, detection rate of distant metastasis is quite higher as compared to CT scan, but it is still in a research setup. Apart from a PET CT scan, there are also other modalities like SPECT scan, which is used for thyroid cases, or SPECT CT, so as to pick up a radioiodine avid neck node. This is again used for thyroid cancers, or for that matter other scintigraphies are also available for parathyroids or even for parotid gland. Thank you so much.